Hello, everyone. Good evening. Good evening. Good evening. Good evening. You're welcome to Watch My Young Adults Forum, and you're also welcome to today's health talk with Dr. DG, also known as um, Okechukwu Chidinma. So I'm going to tell you something. Today is going to be a very wonderful and interesting evening, and you're going to learn a lot of things. So, as you are watching me, I want you to check um, our page and share this broadcast. Okay, today is going to be like this evening. We have something packed for you. It's health talk show, and I expect you to have your topics. Okay, sorry, your questions. Yeah, as she's talking, I expect you to have your questions with in the comment section. So we are going to start any moment from now. Our speaker for this evening is her name is Miss Okechukwu Chidinma. She's a medical student in one of the universities somewhere around the world, and it's going to be an interesting time with her. She's taking us on personal hygiene for disease prevention. So um, she is the founder of a foundation known as Empowering Young Minds. So I am going to bring her in now. We need to start, but before we continue, please, we're begging you to share this post. Okay, share this video, invite your people, your friends to come along and watch with us. So I'm inviting Dr. DG into the screen. Dr. DG, you have to tell us who you are. Let's know you. All right.
Okay. All right. Thank you very much, Dr. Promise. You rightly introduced. My name is Okechukwu Chidima Delight Goodness, also known as Dr. DG. I'm a medical student. I'm also the founder of Empowering Young Minds.
Yeah.
So, good evening and welcome to Young Adult Forum. And today we'll be talking about personal hygiene for disease prevention. If you are online, just indicate you can say something, you can put a wave indicating that you're online, and then we'll kickstart. Anyone online yet?
Yeah, some people are online actually watching.
All right. So today we are not just going to be going theoretical. It is going to be more of practical. I could be showing, you could be seeing some things on your screen. Please, uh, try to be an adult, okay? Yeah. So first of all, we'll try to define what is personal hygiene. From my own perspective, I would define personal hygiene as a practice of maintaining health and preventing diseases, especially through cleanliness. But I'm also going to define it according to WHO, that's World Health Organization. According to World Health Organization, hygiene is referred to the condition and the practice that helps to maintain health and prevent the spread of diseases. This is how WHO defined it. And personal hygiene also referred as the body cleanliness, according to WHO. So, but today, because there are different ways of, there are different categories of personal hygiene. So we'll not just be going, talking about everything. We just take the main things that we need. Okay. So we'll just be talking about the useful ones. So today we are going to be talking about oral hygiene. We're going to be talking about the hand hygiene, and then we are going to talk about the male hygiene and also the female hygiene. Okay. So let's go. What is oral hygiene? First of all, when I mean oral, I mean our mouth. Okay. So first of all, we should know that the oral cavity is the window to the whole body. Okay. If if you pick up anything, any if you want to eat, everything goes through the mouth. All right. So for you to have a healthy living, is a very good step to have a very good oral hygiene. So that being said, um, we'll start with, how do you brush your teeth? How do you even take time to take care of the oral cavity? I mean, the mouth. How do you take care of it? First, let's start with brushing. It's very important that you brush at least twice a day, in the morning and before you go to bed, right? So, apart from brushing twice a day, it's also important that we know this. You know, a lot of people think that, oh, toothpick, once you just eat, you go and use toothpick and clean your mouth. But as medically proven that toothpick does not help. Instead, it damages our gum and give us what is called gingivitis. That is inflammation of the gum. So using toothpick is a no-no. Instead, it is very is medically advised to use what is called dental floss. I'm just going to show you a picture of what I mean. Okay, so I said today was a practical class. We're not going to talk with, we know they see. Okay, so this is what dental flocks look like. I don't know if everybody can see what I'm showing. This is what dental flocks look like. So instead of using the toothpick and just trying to remove it, you just use the dental flocks and try to take off whatever thing that you have in between. It helps you to go in between your tooth. Each of them just helps you to go in between. So that is better to use the dental flocks than use the toothpick. Okay. So moving on, why oral hygiene is important and why we should brush before we go to bed and in the morning. So let's take, for instance, you eat at night. Let's say you ate meat at night now, okay? And then you just used water and go good and you went to bed and you didn't use the dental flux to flux your teeth and try to remove those things. Maybe you have tried to use toothpick and it's going to stay for days before you're able to take it out. On a normal day, everybody has what is called normal flora of the mouth. It's a bacteria that is meant to protect the mouth. All right, everybody has it, so it's not a disease. So it's meant to protect your mouth. It's there. So that's why people that are immunocompromised, let's say someone that has HIV, okay, you will see that they can have what is called oral candida or cancer in their mouth or their esophagus. That's because the bacteria that's supposed to be protecting that place have tried to fight against the disease and it's not going away. So they'll be having what is called oral thrush. So they will have inside their tongue is going to be so whitish. It's not supposed to be so. That's because they're immunocompromised. So let's go back to what I was trying to explain. I was trying to explain that imagine that you ate that meat and you're unable to remove it and you went to bed that day and the next day before you went to bed you ate chocolate. So the bacteria that are there, of course they are the normal flora, they're supposed to be there harmless, but now you're feeding them with those things, those meats that are there. They will just go and they keep fixing on it. If you can see this screen, this is what is going to result to what is called dental caries. The person start having a hole in their teeth. You know, some people say, worm is moving inside my teeth. No, it's those bacteria that you keep leaving some foodstuffs, you're not taking care of it properly, they'll start feeding on it. And that's how someone ends up with what is called dental caries. And again, if you don't properly brush your teeth, there's what is called I don't know if anyone has seen those people that has at the root of their teeth they have some white things on it. That's because they don't properly brush their teeth very well. They don't even visit the dentist. Some people look at the dentist. This is another, yes, this is what I'm talking about. You see how the root of the teeth is so whitish? That's because they are not taking their time to use this flux, go in between the teeth and take off whatever thing that is there and then brush. And The normal brush everyone should use. Don't, we have different type of brush. We have the hard one, which are what we call smoker's brush. It's not what you are going to use. It's not advisable. It's advisable that you use the medium bristle brush. So when you go to the supermarket or anywhere you want to buy your brush, look out here. You will see that it's somewhere written. Okay, it's written medium. Okay, it's written medium. So when you are going to go and buy your brush, just keep checking out for where it's written, either here or at the back somewhere. Is written there medium. So it's the one that is much advisable. Hard brush are usually for smokers, and it's prescribed by dentists. It's not something you just go and buy and use, so that you don't end up having what is called gingivitis. I explained already, like inflammation of the gums. So again, it is advised to use the American Associated Company thing, like toothpaste, if you want to use toothpaste, because some people, especially those in Nigeria, you just go to the market and you go and buy those dental powders. It's not advisable because you don't know what they are mixing with it. It's advisable that when you go to go and buy toothpaste, not every toothpaste is being approved. So when you go to go and buy toothpaste, please look out for toothpaste that have this symbol. I don't know, it's ADA. Yes, ADA is there. It's written there. Check out for it. I think Colgate is, yes, is certified. um I think Oral-B, yes, I think, I'm very sure of these two. So please check out for these things to maintain a good oral cavity, a good oral hygiene. So please, you brush your teeth in the morning. Before you go to bed, try to floss your teeth before you go to bed. Take out all the things you've eaten, from all the junks, all the sugar that you've taken during the day at work, so that you don't end up with what is called dental caries. All right, so that you don't end up with that. Look at it. Some people have seen, some others have this thing on their teeth. So this is as a result of this so much sugar intake, and at the end of the day, they don't even, you know, brush their teeth. They just go to bed, and then when they wake up in the morning, they just brush anyhow. Some people don't even take time to brush their teeth. I didn't say go and brush that blood will not be coming out, or no. Just gently do it, but do it nicely. And it is very advisable that once, at least twice every year, visit a dentist. All right, so that they can help you check out things. There are some things that you won't even be able to take out. It's not when that, oh, the teeth is already paining you, or you see that it's decaying, you now be rushing to the dentist. Some people, they won't even rush to the dentist. They will not be waiting until their face is swollen. Their face swollen is not actually the teeth, no, it's the bacteria that's making the teeth. It's traveling, and that's why the person have a swollen face. And if you do not take care of it, there's what is called infective endocarditis. It's inflammation of the heart. All right, these dental caries can actually cause it. And if care is not taken and proper management is not being made, someone can die just from toothache. So we underestimate the dentist. Please and please, it's very important that you check you go to your dentist at least twice every year. All right, you don't need to necessarily have any problem before you go to the dentist. Just go check and make sure everything is okay. I think that's about oral hygiene. If you have any questions, something that you're not understanding, please ask. Oh, I forgot to mention. And not also brushing your teeth can cause what is called halitosis. That is mouth odor. That when you come out and you speak, everybody's closing their nose. You don't want to go and they say praise the Lord. You want to shout hallelujah, and somebody's doing. You don't want anybody doing that. So it's very important that you take care of the oral cavity very well. And if you are fasting, please, once in a while, just go and take water. Water is a natural sterilizer. Just take it and goggle your mouth and throw it away. Or you can actually get a sugar-free chewing gum and put it to your mouth and just be mumbling it, because the more and another natural sterilizer is the saliva. Okay, instead of taking sweets and just be licking sweet and be saying that you don't want your mouth to be smelly, it's better you just buy sugarless free chewing gum, like Orbit. I think they have that in Nigeria. You can just put it in your mouth. It helps. The more you're chewing it, you will see that there's saliva will be coming out. It's helping to sterilize the mouth. That even when you speak, nobody have to do All right. So that's about oral hygiene. So let's go to the hand hygiene. We underestimate washing of hand. Thank God for coronavirus. In a way, we thank you, because now people get to wash their hand and even sanitize. Before, some people no dey even remember say they go wash hand, except they wan chop eba, na they go remember say they go wash their hand. You see, hand hygiene is very, very important, because our hand does a lot of things. You are in the market, you're touching money, you want to drag for bus, you're driving, you don't know what bacteria has settled on the surface where you're touching, and you just come back, and the next thing, they don't give you akara and bread, don't press and just they chop am like that, and no sanitizing, no even small. If you no wan use soap, you no even fit use water wash hand small. So hand washing is very important. You know why? Because you can actually get what is called, this thing we are saying, food poisoning. Food poisoning is not when somebody puts poison inside your food. It's not when somebody puts poison inside your food. It's from your hand, and not trimming your nails and taking out all those dirt under it. And the next thing, they don't go yafusi, they have bring this thing, amala and gbegiri. We just do small cram 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 like this, and you're licking your hand. The next thing, my belly is like, that woman, that place she's cooking is not clean and all those things. No, the woman might be very clean in her cooking. It's just you who didn't do a proper hand washing. You didn't clean your nails very, very well. You just go and do 5 second, 2 second washing, just like this, like this, like this. So it's advisable to use antibacterial soap to wash your hand at least 20 seconds. Wash it properly. Wash like this, like this. Try to, wash those nails very well. Teach your children, for those that are married, the hand washing technique is also called toilet training. Just part of the toilet training, that anytime you use the bathroom, you come out, you wash your hand, inculcate it in your children. It will help a lot. And those that have husband, once they just come back, you say, honey, oh yeah, to the bathroom straight. Put somewhere that that everybody know that that is how, once you're looking at it, that is for hand washing. Put a towel there, put the antibacterial soap like Safeguard, Dettol, they have another one, Lifebuoy. These are all antibacterial soap. Even Lux, just put it there and make it mandatory that once everybody are coming from outside, just straight go and wash your hand, because it can help a lot. It can prevent a whole lot of things. And that is that about hand hygiene. I hope everybody's following. Am I going too fast? Any response? I'm waiting for response.
We are enjoying you. Please
Okay.
continue.
All right. So I said that I was going to talk to my brothers and to my sisters about personal hygiene. So now let's go. First of all, we'll talk about the brothers. Today is Men's International Day. Brothers, are they hail you now? All of you are great, doing very well. But today we are just going to be talking about the hygiene. How to be looking sengemenge, even in your kabashing spirit, okay? That even when you come to church, nobody will be running away from you after you have kabash just only 5 minutes. People will just be running away. So let's go. First of all, the toilet hygiene for the brothers. Some brothers don't know that there is what is called toilet hygiene. There is. When you go and finish, easing yourself, doing number one, not number two. Some people don't even bother to clean up very well. They will just shake the thing, pia pia. Some people don't even used to bother self. They will just do anyhow and come out, and the thing will just drop on their boxers. And some of them, they will not now wash the boxers. After 5 days, they still they wear them. Now, wow, bro, there is God though. So even inside toilet hygiene, even hand hygiene, dey inside. If you piss finish, please wash your hand. You hear? Very important. So brothers, when you go to the bathroom to ease yourself, if you cannot wait to shake finish, please collect tissue and clean. Very, very important. Clean with tissue. Thank you. Moving on, showering. Hmm. Now, wow. Some people will just go to shower. 5 seconds, they have come out. You say, bro, you don't finish. Nah, sharp, sharp. Nah, you don't need to waste. Nah, man, nah, be, I no need to waste time. I go the bath like woman. Hello? Really? Hmm. Please, oh, showering is very, very important. How do you shower? Very, very well to maintain a good personal hygiene as a guy. When you go to the shower, please endeavor to clean the armpits properly. All right, take your time, scrub your armpits very well. And then the groin areas. Internal father is our refuge. Some people don't even remember that that part of their body exists. They just do the thing sharp, 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 sharp. They have come out, bam. Please, when you want to shower, take your time, especially in the evening time. Maybe in the morning you are rushing to go to work, but when you come back in the evening, take your time and shower. It's very, very important. I will tell you the reason. So when you wash your armpits very well and the groin areas, please lift up your bronchus and clean it very, very, very well. You will not go to hellfire. It is you that have it. No, you are not sharing it with anybody. Please clean it very, very well. Wash it. Use water. Take your time and wash that place very well. Because the lack of washing that place, this brings it causes, we are talking about personal hygiene and what you prevent. So what you are preventing by doing this is what is called jog itch, occur junction. That one that is very, very sweet. You want to be scratching and scratching and scratching. Some people have it, but they'll be using spirit cocoa to be covering, to think that brother is in the spirit. He's not in the spirit anything. It is something that is really, really itching him, but he does not know how to scratch it. These are the reasons, because you're not taking care of that place very well. Please, it's very important, so that you don't have this kind of rash on the screen. All right. And shaving. Shaving and using of deodorant. I haven't seen anywhere in the scripture that I've said, and if thou shave, thou shalt go to fire. I never see am. If anybody does, I made them tell me, I beg. Brothers, just because you're not showcasing six pack, you're not wearing singlets, you will not shave your armpits. You will just be lying everywhere. When you raise up your hand to worship, somebody can't even stand. Lord, please shave your armpits. You're not leaving the bush there for anybody. I don't know why you're leaving it. Very important. Shave. Use deodorant. It's not a sin. In fact, this is the men's deodorant. I hope everybody can see my screen. It helps. For those that sweat a lot, you can use this. It will help your life. But you're not going to be using it on unshaved armpits. No. You have to shave and take off the hairs so that it will work and you will smell nice for the Lord. Not just the armpits, also the groin areas. We dey even talk am. Some people say that side, that part, be like say no be them get am. You get another person wey get that side. Shave that part very well. Take up the scrotum, shave everything. You can use scissors, trim it first of all. If you are not seeing road, use scissors and trim the thing first, and then you try to shave, so that even when you are washing it, you will see where you are washing, because you cannot be washing on ordinary, just washing hair. And for those brothers that are beard gang, if it is shampoo that you go and buy and shampooing the something, please do. Very, very important. So that is that about that. I've talked about showering, shaving, using deodorant. Very important. This one they say is 48 hours dry protection. The name of the deodorant is Mensure Motion Sense. That's the name. I hope everybody can see what I'm showing, okay? And then when we talked about the hand hygiene in before we got into this male hygiene, I talked about washing of hands and also the fingers as well. Because if you don't cut your nails, trim it, even if you wash your hands, there's every possibility that your nails are still going to have some germs. And I already told us that someone can have gastroenteritis, that is purging. Yeah, practically it's purging, like diarrhea. That's what the person can have. Like I said, food poisoning, because you practically put it in your mouth and you licked your fingers and everything swallowed down, goes down to your stomach, and then you start reacting, you start purging, you start vomiting, and then you start looking for village people. There's no village people anywhere. It is just you that is village people alone. So brothers, especially those that are doing all those skillful jobs, maybe like let's say bricklaying work where you have to mix all the cement and everything, those that do the welding job, when you come back, trim it. If you cannot go to, don't go to Abokio. Now they even have nice places where people can even go and chillax and put your hand like this and they help you and do it. If you are married, your wife can help you and you pay her in return. Really? Okay. Again, best spread. Hmm. So if like say some people their best friend never see water maybe since the beginning of January, because the color no be white, the color get as the color be, so nobody even fit notice am like that. Please, if you are like that, bro, try the wash. The wash am. If you know if you wash am immediately, if you soak am overnight, make the dirty fit comot. Then in the morning time, you go just scrub am with your hand, soak am again. All right, that will help. At least for brothers, maximum time your bed spread should be on your bed should be at least 2 weeks. 2 weeks is enough for a brother, because they are busy people doing one or two things, so they feel no get the time. But at least 2 weeks should be enough to wash the bedspread, the pillowcase, because also don't want to have a korokoro and all those things, because some people they'll be so tired when they just come back, they'll just fall on the bed, yakata like. So you need to be washing your bedspread. 2 weeks is enough for brothers. So I've mentioned the what you're preventing. If you're not showering very well, if you're not shaving, you're likely to get um jock itch, which you can also get body odor, and now you'll be looking for how to get rid of it. So in order not to get all those things, please try to maintain a good hygiene of showering properly, shaving, using deodorant, and even using perfume. These things are good for us. Okay? Brothers, make una no vex for me. Thank you. So moving on to the sisters now. Any questions, anyways?
If there are questions, we'll let you know.
Okay, so I'm going to try as be as plain as possible so that everybody will understand whatever thing I'm saying, so there wouldn't be much confusing questions. Okay. So now moving on to my precious, wonderful sisters in the house. So sisters, just as I spoke to the brothers, sisters now they talk say we dey complicated. Make una no mind them. We are special people, okay? Mhm. So sisters, toilet hygiene. How should a lady wipe? Right? How should a lady wipe when she goes to ease herself? I call it restroom hygiene. How should you wipe when you go and you just, ease yourself? It's the appropriate way for a lady to wipe is from, how do I demonstrate? I think I have a picture of that. Yes, that's it. From the front to the back. All right? After you ease yourself and you stand up, you go from front to back, not from back to front. Some people they'll just do it like this fear. No, it's from, you can see it at the picture that is there on the screen. Okay, that's the proper way to wipe as a lady. The reason is this: the female have a short urethra. Okay, So they are very susceptible to infection. I mean, they are prone to infections, UTIs, urinary tract infection. So if you wipe from back to front, remember that you're going to, um, maybe you're going to do number two. So you can imagine now, say you clean yash, you no clean and well. When you be, do number two, you now came to come and ease yourself, right? You now cleaned from back to front. You're practically bringing what is from the back, that's from the anus to the vagina, all right? And that can cause a UTI. Later on, I'm going to be explaining, saying the types of UTI that this can give, because we also have other things that I'm going to be mentioning that cause UTI. Okay, so that's the a better way to wipe. Instead of coming from the back to the front, you go from the front to the back. That's about the restroom hygiene for my wonderful sisters. So showering now, how do you shower? Do you just enter the bathroom, Maya, pia, 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 just you have just do and you have come outside? No. So as a lady, you should be able to shower very, very well. Okay, wash your armpit area, lick your breast as well, under there. Wash am. Some people no dey remember say that part be that is part of their body at all. They go just do why they just wash, the front where they are seeing, and that's it. No, especially those that are very busty. You're supposed to take your time, lift up the breast and clean under there. You might not really sponge so hard, but try to clean that part of your body. Is very, very important, because um remember that, in your day's activity, with the weather condition in Nigeria, you'll be sweating a lot. Plus the bra you're already wearing, all the sweat is pouring there. You can imagine now, you now come back, you come out the bra, you now go, you bath, lift the breast, wash well. You'll be having what is called psoriasis. It's like a scaly thing. I think I should have a picture of it, okay? You'll be having like a scale like something under the breast. I don't know if anybody have ever experienced that before. That is because you're neglecting that part of your body. So this is not a poor hygiene can cause what is called psoriasis. That is rash under the breast. That's what it practically means. All right. Forget about the medical name that they gave it. It just means rash under the breast, because they wash that part. That part now you get, and no be another person get am. You hear? And then moving on, the armpit. We talk about the armpit now, under the breast, and now the cocoa of something, our vagina. Now wow, some people say they do anyhow for that side. Please wash very well. Don't use soap. All right, don't use soap. No, water is okay, but if you must use anything to clean your vagina, all right, please use feminine wash. I will just show you a sample of what feminine wash look like. This is feminine wash. They have different types, okay, but when you are buying, look for the ones they wrote pH balance. I don't know if everybody can see what I'm showing. Use the one that is written pH balanced. That is because our vagina has a pH balance of 3.8 to 4.5. So you can imagine using soap that has all this sulfur inside. You now use it and be washing your vagina. It will cause more harm than good. Yes, I know you are trying to be clean. It will cause a lot of problems. You are going to disrupt the normal flora of the vagina. On a normal day, this, when you hear E. coli, somebody will say, oh, is this thing, or is UTI? No, the normal flora there is the normal flora of the vagina. But now when you go and alter it, and then by using soap, I even heard that some people use apple cider vinegar. Anti-alpha. That is very acidic. So what we are talking about is the vulva. Look, I want everybody to look at the screen so that I will explain what I'm trying to talk about. So our vagina has three openings. All right, we have the clitoris, we have the sorry, we have if you can see what I'm trying to explain, there are three small holes. The bigger hole is the vagina. That's not where you're putting your hand though. No. You are washing the all those the other parts, right? The smaller hole, the urethral hole, that's where we pee from. That's where every lady pee from, not from the bigger hole. But some people don't know. They think it's when it's from the vagina. That no. It's from that hole after where it is that's called the clitoris. The next hole, that's where everybody pees from. So you're going to be, it's there you're going to be washing, because ladies, we have vaginal discharge. All right, that's why you need to take care of that part well. Let me say picture of vaginal discharges. I don't know if it's bigger on the screen so that we can see. So this, every lady have a vaginal discharge. It's a physiological thing that happens to every lady that is up to reproductive age. We have discharges. All right, you can see we have the one that are creamy, the one that are like egg whites, and then the one that is very thick. That is when you're on your ovulation. Is very thick. And then we also have the ones that are abnormal. I'm going to explain that. All right, later on I'm going to explain that one. So you see, that is the reason why you need to be washing your vagina, because every day, you are going to be having discharges coming out from there. So imagine, say, they wash that place very well. It will just be accumulating. Every lady should be able to know what her normal vaginal discharge is. If you don't know, please pay attention to it right now. From today onwards, try to pay attention. You can even get panty lining, okay, if you want to know. So panty lining is something like this. I could actually open this and show you guys. This is what it looks like. A smaller form of pad, all right? Okay. So you place it on just the normal way you put your pad, but this is just small. So that way you'll be able to see when you have an abnormal discharge, all right? This can help you out. Okay? Yeah. That's that about that. So I was saying that it's very important that we take care of that place very well, so that when there's any change, if there's an abnormality, you will be able to tell. If there's any foul smell coming from there, you will be able to tell. But in a situation whereby you don't even bother, you don't even care, you just do your normal thing, when there is an abnormality, you cannot tell until it has gone too far, that you now need to start taking a lot of antibiotics. You need to be taking a lot of medication just to get rid of the UTI, that is urinary tract infection. But if you are taking care of it very well, if you're maintaining your personal hygiene very well, you'll be able to know when there is something has gone wrong. Okay, so that's why it's important for us ladies to, when you are bathing, even doing the breast examination thing is important, because if there is any change, you'll be able to detect. For those that don't know how to do the breast examination, when you go to shower, stand on the shower, put your hand like this, all right, and try to, do try to, palpate, all right, press, that's what I mean, and check for any abnormalities. You can do that every day if you want, or twice in a week, once in a month. That way you'll be able, you are taking care of yourself. It's part of personal things, your personal thing. So if you check and nobody will help you check them. So you'll be able to dictate if there is any abnormalities. But if you're not practicing personal hygiene, if there's an abnormality, you won't even notice it. Because all your own, you just go and bath and go. Or except maybe something really starts paining you very well. You'll be like, this thing is paining me. But you would have detected it a long time ago, and maybe problem would have been solved early. So you see why personal hygiene for ladies is very important. You can really solve a lot of problems without even going to the hospital to see a doctor. Moving on. So shaving and using deodorants. I've been seeing a lot of videos flying saying those that are using this in shade they will go to fire. I haven't seen where it is written and when thou shalt shave and use deodorant and thou shalt go to fire. Never see am. So it's very important that as sisters, please try to shave your armpits. That you're not wearing spaghetti hand to go to a clubhouse. That you're not wearing all those off shoulders. You're not wearing bikinis to go to the beach. You will not now shave down there. You also not now shave up here. And wow, that's let me borrow from Dr. Promise that some people be smelling iniquity. Me, I know sabi how iniquity they take smell, but you don't want to experience it. Because if you experience it, Jesus Christ. So that being said, please shaving the armpits and using deodorant is good. If you're a lady and you sweat a lot, you can also use the brothers this type of um deodorant. All right. But if you don't, you can use this one is for the sisters. Okay, it's still the same company, or like it's still the same thing, but just that this one, the men's own now is more stronger. Like it can last you, and you won't be able, you won't sweat, right? The sisters own, yeah, is there. It has nice, perfume. So you can use it. If you cannot afford it, there are other ones. So these ones are even cheaper. See, these ones that you just do like this and you do it like this and so these ones are also good for sisters. Shave and use deodorant on your armpits and smell good. We will package ourselves. So, and for the um sorry, for the pubic areas is very, very important, because even sisters self fit get the occur junction that I mentioned in the brothers too. All right, they can get it as well. The job itch, yes, even ladies can also get it. If you don't take care of your pubic areas very well, you can also get it, because that place will be, you'll be sweating, and you will now be wear, some ladies sef, they wear pants, they will now wear tight on top and come and now wear skirt. Hello, ha. Now wow, so you need to shave that place, give it some breathing space so that some air will enter and help you know do things very, very well. So I'm not saying don't wear tight. So yeah, wear tight, but try to shave and take care of that place very well. Okay, because we also menstruate. So you can imagine that you're not taking care of that place very well and you menstruate now. And at this, thank God I just remembered this. I know that some sisters they will only change, if they're menstruating, they will change their pad maybe like 2 times in a day. Why now? Why? It's a very poor hygiene, because you can cause yourself what is called toxic shock syndrome. You become very, very sick. All right? You become very sick. This is something that the body is shedding. And now you now leave it, some will be, because remember that when you're menstruating, your body is kind of open. All right? So you can imagine that it's not change that part. You wear one part maybe like from morning, you didn't even change it maybe midday, you now wear it from morning till 2 o'clock in the afternoon, and you'll be sitting down. Even the things that have come out, they will even try to not be going out. Sometimes some people, when they bring out the thing, some part of their part don dey turn green until half an hour. You cause yourself what is called toxic shock syndrome. It's the symptoms are, you will have very high fever, you'll be very sick as shit. So you don't want that for yourself. So it's also part of the sister's hygiene. So you have to change. I don't know if some sisters know what is called tampon. Please don't use tampon. Maintain the normal pad using. The tampon is the one that they push in the hole. All right? Don't use it, because you can make mistake and trying to draw it out and the rope will cut and the thing just gets stuck inside. So please just maintain the pad using. If you are using tampon, just make sure you know how to use it very well. But if you are not using it, please stick to the normal pad that you know how to use and try to change. All right, at least from 9 o'clock till noon, you change to another one. From that noon maybe to 2, you change, and just keep depending on how your flow is. I know that pad is expensive in Nigeria, but that will not make you to get yourself infected. So moving on, I said I was going to tell us the things we'll be preventing if we are taking care of ourselves very well as sisters. Sorry, I'm checking my time. Um, First, you're going to prevent yourself from UTIs like yeast infection. So now this is where your personal hygiene comes in. When you have an abnormal discharge, you'll be able to know. So this is what yeast discharge looks like. You see, it's like cheese. You know what it's called, cheese? This is what it will look like. And remember that I've showed us in a previous slide what the normal vaginal discharge looks like. Like some are just creamy, the other one is like egg white, and then the other one is very thick. That is when you're on your ovulation. And you see this one that's like cheese is an abnormal discharge. So it's your personal hygiene that will be able to help you notice when something has gone wrong. So vaginal yeast infection is you need to see a doctor, all right, to take care of it. And also there's another one called bacterial vaginolysis. This one, when you hear some people's vagina smells like fish, yeah, smells like fish and a mixture of fish and raw onion that is being cut, just know that you have infection. That is as a result of um, not taking care of yourself properly. You can get yeast infection, bacterial vaginosis, that your vagina will be smelling like a fish.
Fishy smell, yeah.
Yeah, fishy smell. And you can actually take care of it. You can prevent it now and don't get it. So far so good. Sisters, are we here? You should not crucify me. I'm just trying to enlighten us on things we are supposed to know. And you can even get itching and all that. For the job itch, the person is going to be having itch there, and it's a fungal infection for the job itch that I mentioned earlier. Yes, that's it. Job itch in women. Oh my god, picture is not coming out. Yeah, this is what it looks like. Reddish, somewhat like how do I explain it that everybody understand? I hope everybody know what is ringworm. Though it's not ringworm, but just picture ringworm in your head. If you have seen anybody that has that ringworm thing, yes, that's what it looks like. It will not be very itchy, and it's actually contagious. All right, for those people that like to share cloth and towel, if you share towel with somebody that has this thing, you automatically have gotten it. If you share cloth with somebody who has this, you get it. So it can be passed from one person to another. This particular this particular fungal infection, it's it's very very contagious. So for those that want to be sharing cloth, to you want to be sharing everything because you want to slay on anywhere, please just be very careful, okay? And toilet hygiene for sisters is very important. Try to clean your toilet at least every Saturday. If you are too busy, maybe every 2 weeks, try to wash your toilet. You know why? Because we ladies, our body, we are very much prone to infection, especially UTIs, because our urethra is very short. So if you go somebody having a yeast infection, maybe just go to the bathroom and just go and use it, and you go and sit in that place too, you just, and now the urine, you are trying to urinate and it splashes back, you just catch the something. You that have been, minding your business, trying to keep yourself clean. See why it's very important that everybody maintains personal hygiene. Those in school, you're sharing a room with a sister and you have decided in your heart of hearts that you don't want to be clean. For the sake of other people, please just be clean. Be clean. So that you don't, somebody who is trying to be clean for herself, don't contact something that she did not plan. She will now start buying medication she did not bargain for. That's why it's very important that everybody, not just let me just learn for myself. If she no want to, na she sabi. Just try. Because when you start spending money buying drugs, that's when you know that Khaki no be leather. To cook beans no be small thing. No be now wey gas expensive. So you that time you understand what I'm talking about. Ehen. So it's very important that the toilet hygiene, you clean your toilet, put the antibacterial soap for washing of your hand. Once you use the toilet, you wash your hand. In a way, I'm trying to round up and recap on whatever thing that I have said now and add things that I haven't said. Okay. So practically, we've talked about oral hygiene, trying to brush our teeth, using the dental floss. Oh, I even forgot mouthwash. If you can afford mouthwash, you can use it in between meals, maybe in the afternoon, so that you don't over brush. So when you finish eating, you can just use it and goggle your mouth and throw it away so that your mouth will still smell fresh, because you don't want later when you are now, ignoring to brush your teeth, you now have what is called halitosis, mouth odor, that when you say praise the Lord, everybody will run away. So we have to prevent it now. Okay. And then we've talked about the brothers, hygiene, trying to shave, bath very well, using the deodorant, even the sisters too using the deodorant, sisters also using feminine wash. And I've shown us the type of brush we're supposed to be using. And the maximum time everybody should use a toothbrush. 3 months is enough, and you change it. And I forgot to mention that, please, everybody try and buy something. Brush container. Put your brush. Try to put your brush inside something. All right? Try and put your brush inside something. Don't just leave it and all the cockroach and rats, they come and dance a lantern on top of your brush, and tomorrow morning, because you even use hot water to wash it, pia, you have used it and brush your teeth. So it's better prevention is better than cure. So buy something and put your toothbrush inside of it. It must not really be this. You can buy there are other ones. Oh, I don't have that here. You can at least cover. Make sure the most important thing is covering your toothbrush here, protecting it. Okay. So if you can't afford this one, they have the smaller ones. Some toothbrush even now come with it these days. Try as much as possible to cover your toothbrush. Is very important. That's what I missed out. I just thank God I have this here and I remembered. So that's that about that. And sisters, please don't abuse antibiotics, because it can disrupt the normal flora, and you can get infection. Any of the infections I just mentioned, yeast, vaginal bacterial vaginosis, you can get it actually by taking so much of antibiotics. Okay. So if it is not being prescribed by a doctor, don't just go and say that I think something's wrong. I think you just go and buy Flagyl and take. Nobody ask you. Fear you have go and buy it because you have money to buy. If you're not feeling okay, just make sure you get a prescription from a doctor. Don't just go and just be buying any medication because you think that is what is wrong with you. I think I have malaria. How do you know? Because of the symptoms that I'm having. My mouth is bitter. That's how my urine is. That's how it's smelling. You now go and buy. For ladies, so it will cause you more harm than good. For brothers, because they have a longer urethra, they will not get they're like UTIs, urinary tract infection, the way we ladies get it. That being said, I did not say that brothers can also not get infections. If people can also get infection. Those that have decided not to be washing their toilets very, very well, you will just get infections, and that infection, and brothers own is very bad though, because it go take before the thing go show. But when the thing don't show, then be say it don't take inside the body. What I'm trying to say is this: that before it manifests in the guys, it must have been in the body for a very long time before they start showing symptoms. Okay. So it's also keep your toilet clean, because the brothers own self can get syphilis, and maybe it will not show for a long time. They can even get gonorrhea. Okay. So that's how bad the guys own is. Yes, the ladies can pick it up very easily, but the guys, they might not be able to pick it up. But when they do, it is not nice. So also maintain the toilet hygiene, clean your toilet. Because now in the ministry, sisters are not allowed to visit brothers. So anyhow, we just leave the house like that. Anyhow the thing is, we just leave am like that. Abeg, no babe dey come. So you see, it's very important to clean the toilet. All right. Sorry, guys. I'm checking. I'm keeping track of time so that I don't exceed my time. I think I've exhausted everything I think I know about personal hygiene and how it can help everybody, the brothers, the sisters, and on a general note. And for our mothers in the house, you guys are also not excluded. You can also teach your children the hand washing, the toilet hygiene, start teaching them, or even the oral hygiene. You can tell your children that, hey, Amaka, 8 o'clock in this house, nobody's eating chocolate again. Everybody to the bathroom, go and brush your teeth. And you monitor them and they grow up with it. So they know that at 8 o'clock, nobody's eating anything sugary. Remember what I explained that it does when you are sleeping. Of course, those bacteria just go there and keep feeding on it. And before you know it, start having holes in your teeth. And you don't want to die. Life sweet too much for person to just die like that when you never fulfill anything. So you go good, so may you live your life and fulfill your ministry. So teach your children very well. And that is a wrap. So any questions? Any question of the day? Oh, yeah, hit me. I'm waiting.
You say they should hit you with the questions.
Mm-hmm.
Thank you so much. Thank you, Dr. DG. You've done a whole lot on this particular topic. Um, let's just go straight to the questions. You've said
Right.
a whole lot. So I hope our viewers out there listen to this seminar. And we urge you, if you have any questions for Dr. DG, also known as Miss Okechukwu Chidinma, we want you to write the questions in the comment section. Let's see your questions in the comment section. Okay, put down your questions in the comment section. All your questions on personal hygiene, we want to see them in the comment section so that we can do justice to them right here. All right, thank you very much, Dr. DG.
All right.
Uh, someone has a question,
All right. I'm listening.
and you will see it right on your screen. The person said, nothing on remedies. Nothing on remedies.
Okay. I'm so sorry. Oh my God.
Okay.
I'm so sorry. Remedies on what in particular?
Let's start with remedies of toothache.
Okay.
Okay. Sorry, not dental caries. Okay. For
Which
instance, I
one?
think we can see dental caries on the screen.
Mm.
So, what are the remedies for dental caries? What should the patient or a person with dental caries do? What should a person with body odor? Okay, what are the remedies? For instance, now
Okay.
for ladies or sisters who have jock itch, okay, they won't
Mm-hmm.
tell you, but they are scratching, okay, or
Okay.
brothers who are scratching or
Okay.
itching. What are the remedies? Yeah, so
Okay.
let's start from first. Number one, dental caries. What are the
Okay.
remedies? Yeah.
So for those that have dental caries, because it's already there, okay, once you notice it, please visit your dentist immediately. Okay. I will not tell you there's a
Okay.
natural remedy that you just put it there to stop. No. Just visit your dentist immediately. They know
Where can we? Where can they find dentists?
okay, I think when you go to the hospital, they have I don't know how to explain that. If
Yeah.
okay, if it's where I
So
am,
people,
I
when
know how to. Okay, I
I know
think
you know.
I think I know a dentist in Nigeria who can actually help. Yeah,
Okay.
if you have, yeah.
Okay. So
If
everyone listening, you have dental holes. You check your teeth. You find out that there are holes, or you have this kind of thing you are seeing on the screen. Okay, holes in between the teeth, or those black stuff. Okay, or you have this type. Okay, this type, you can see it on the screen, or
mhm.
what you have is this type. Some people finish brushing their teeth and still see all these black, yellow plaques in between their teeth. Okay, you need to visit a dentist. Let me tell you, our dentists in Nigeria know how to do a lot. They're going to shock you. So remedies for any tooth problem, tooth issue, toothache, dental caries, you have to visit a hospital. Okay, visit a hospital and then they will refer you to a dentist, and the dentist will take care of that. This is for
Exactly.
teeth. Yeah, thank you. So that's, I
Okay.
just added that. So Dr. DG, over to you. Remedies
Okay.
on any other thing you talked about.
Okay. So for those I mentioned the drug stick itch, right? Drug itch, sorry. Because it's a fungal infection, so an
Good.
antifungal cream would help out.
Okay,
Okay.
antifungal cream is going to help out, right?
Yes, antifungal creams is going to help out.
Okay,
Or you can visit a doctor so that they will actually take a look at it. All right.
very
To
important.
see.
Say no to self
Yeah.
medications, people.
Yeah.
Yeah.
Always see a doctor when you suspect anything, even the UTIs. Okay. The reasons why I didn't outrightly say any medication is this: people abuse medications a lot. Sorry to say, but especially in Nigeria. So that's why I didn't mention any medication. Not that I didn't want to, but when you say these things, instead of people going to visit the doctor, they just go straight away to the pharmacy, and the the system over there in Nigeria is not helping at all, because over here you can't just come to a pharmacy to buy uh, an antibiotic. No, you have to come with a prescription from a doctor, signed and stamped. So, but then in Nigeria, once you just give somebody something, they just abuse it. So that's why I didn't. I intentionally didn't mention any medication. So if you have any um, any change in your vaginal discharge, if you're itching, if you're having those kind of discharge that look like cheese, like another better way to explain that
Mm,
kind of thing, just in case for people who don't understand, cheese like all this lumpy kind of egusi coming out. I think that's a better way to explain. Sorry that I have to spoil it for you guys, but that's a better way to explain it. Please visit a doctor. Okay, very important. Don't do any self-medication, please.
all
And for
right.
those that have body odor, remedies is this. um Remedy is trying to
There's a
bath at least
question for
twice.
that. There's a
Which one?
question for that. Say, how can one, from Barrister Oyaha Michael, say, how can
Okay.
one avoid mouth odor,
Okay.
and how can one cure mouth odor? Yeah.
Okay. So if you know that you have halitosis, that is mouth odor. So first of all, that is still, dentists are very important. Okay, you have to go and find out what's going on. If you've done everything, you've brushed your teeth very well, you've floxed. Okay, you've used the dental floss, used the mouthwash, or even try to do the gum thing, like try to chew and always keep your mouth sterilized. Try to go and visit the doctor, because there's what is called tonsil stone. I didn't
Mm,
mention that. I
mm,
didn't mention that, but now that questions are coming, thanks, Barrister, for asking that question. There's something that is called tonsil stone. So this is everybody have tonsils in their mouth. You
mm.
can, it's sometimes, maybe if you use a mirror to look, it's down close to not very close here. If from here, yeah, it's inside. So they are open. So when you eat, that's why I still say that it's very important to always brush at night and try to goggle your mouth and take out everything. So when you eat, this is what happens. When you eat and you didn't brush, or you didn't do anything and you go to bed, okay, those bacteria start feeding, and it's some of the things go and start forming inside the tonsil hole. All right.
Mm.
That's sometimes when you brush your teeth and you um, try to cough, there's sometimes some yellowish little things come out. I don't know if anybody has experienced that. Anyway, I saw that in the hospital. So that thing, the smell of that thing can awaken the dead. Oh my God.
Hmm.
Smells very terrible. So some people have tonsil stones. You cannot know these things except to visit the doctor. So if you don't take them out, right? If a doctor don't help you take them out, you can't take it out by yourself sometimes. Though sometimes you can, maybe if you really use your toothbrush, if you are seeing it and you can use your toothbrush to bring them out. Yeah. But if you cannot, if you don't take them out, no matter how you brush, you will still have that smell because the thing that's causing it is there, is right there inside the mouth, right? Inside the tonsil hole. So that's why it's still very important to still visit the doctor and they'll help check, make sure that mm, you're not having yes, that's it. Yes. Thank you very much, Dr. Promise. I don't know. That is the tonsil stone that I'm just talking about. It just came to me right now. I didn't plan to say that. So yeah, that's it. That thing, the smell, like I said, it can awaken the dead. Oh my God. I have no idea. So you see where the tonsil is? I hope everybody can see the screen. It's right inside our mouth, close to the parotid gland that's here. Sorry, don't forget about the medical terms, okay? Just look at what I'm trying to say. So those things, they just go right inside that hole and stay there. You personally can't take them out. Only a doctor will use their techniques to take them out. Okay, these ones are basically done by the ENT doctors, ear, nose, and throat doctors. They're the ones that help take out the tonsil stones. So I hope I've answered your question. So if you're able to take that out, yeah, and do the normal, the proper thing you're supposed to do, then yeah. If it doesn't resolve, then there might be other medical problems. Sometimes people have what is called acid reflux. Okay, people that have ulcer. Um, so basically, this is what happens. This is the mechanism of action that happens. People that have ulcer, and
Mm-hmm.
sometimes they have what is called acid reflux. It's called
Yeah.
GERD. So maybe when they sleep, the acid from the stomach comes up. All
Cogitates.
right.
Yeah.
Yes, it comes up. That can also be a problem, right? So you still need to see a doctor. They have to check and make sure what is the causing factor of the mouth odor. It comes up. Sometimes the person can have what is called chest. And we're not talking about peptic ulcer today. So I'm just trying to say what can cause that. Some people have what they call acid reflux. So the content of the stomach comes up and then can now cause very foul smell to the mouth.
All right. Thank you very much. In summary,
Sure.
to answer that
Mhm.
question, as in for your as in to summarize what you just said, you're trying to say whosoever it is that has mouth odor, it could be as a result of one disease condition or the other. So it's actually
Mhm.
necessary for the person to see a doctor, right?
Yes.
To be able to diagnose whatever the person has. All right.
Yes.
Thank you very much for that answer. Very wonderful. Another question coming in right now.
Okay.
Okay. Says,
Mhm.
okay, please, can the doctor shed more light on toxic shock syndrome?
Okay.
Yeah.
So toxic shock syndrome, okay, is basically like I explained. Um, it's a very rare condition, but it's possible.
Mm.
Yeah, it's rare, but it's very possible. And if nothing is done, it's fatal. So what basically happens is this: if let's say you're wearing a tampon, like I said, or a pad, and then you leave it there for too long, all right. Remember that I said that everybody's body has a normal flora, including the vagina has a normal flora. Those normal flora, which are bacteria, they start acting on those things. Okay. And remember that our urethra is very small and the person gets affected. So the syndrome, how the syndrome comes about is that you'll be having a whole lot of things going on at the same time. That's the syndrome. We're having very high fever, shivering, like be what they call as sick as shit. That's how they explain it. A whole lot will be going on. Okay, your hands will be so cold and even changing color. That's why I say it's a very rare condition, but it's very obtainable. So I don't think there's anybody on the group that wants to leave their pad for 5 good hours or more than that. Or in a day, you just change your pad once. Just change it in the we put one when you are going to work, and the next time you are changing it in the night when you come back to go and you want to not shower and go and sleep. I don't think anybody will be doing a thing like that. It's a very rare something, right? So to prevent that, don't put your pad, don't allow your pad to stay too long. If you everybody knows how their period is. If you have a heavy flow or a light flow, at least if you have a heavy flow, you should be at least changing your pads like maybe 4 or 5 times before the day runs out. Okay, and you should know how to handle that so that that you don't get the
Okay.
same. Yeah.
Okay. So, in summary, you're trying to tell the ladies to ensure that they don't keep their tampons or pads for a
Yeah.
long time. Right? Yeah. So, how long? How often should the ladies change their tampon, their pads?
I just said mentioned now that it depends on their flow. Everybody's flow is different. Some people
Okay.
have heavy flow, so you should be able to know how your period is. Okay.
Oh, okay.
Mhm.
All right. Thank you so much for that answer. So, next question: how can antibiotics, abuse of antibiotics, can it infection? How can it cause infection?
Okay. So
I assume it's for the vagina. So how can it cause accumulation of bacteria in the vagina, abnormal bacteria in the vagina?
I said remember that when you're taking antibiotics, I don't know if people know this, that when you're taking antibiotics, either they tell you to take it with all this blood, tonic, and something to boost your immune system, right? You don't just take antibiotic like that. So you can imagine that you're just going to go and buy an antibiotic and you're using it, taking it. Let's take flagyl for instance. Okay, flagyl is even a mild one, and then you're taking it and it's into your body. You're going to be, like I said, disrupt the normal flora. And when it is disrupted, your body is prone to infection, UTIs especially. I don't know if what I'm saying is even making sense. If the sister that asked this question, if the thing made any sense to them, or the person that asked the question, it will disrupt the normal flora such that the person's body is prone to infections. It's just like saying that somebody's immune system is not strong. So when you're taking that antibiotic, it's like kind of um yeah, it's doing something, maybe you're taking it for something, but then abusing it, taking it when you're not supposed to take it. That there's a limited time. Even when you go to the doctor, they tell you, I'll take this for 2 weeks. Some people they just keep taking it and take it. There's a reason why the doctor say take this just for 14 days. There's a reason. Because yeah, antibiotics is doing its work. It's also causing other things. Every medication have side effects. So that's why doctor will tell you, okay, take this one, this particular one, just for 2 weeks. Take this one only for 1 week. Because there's a reason for that. So you can imagine just entering into a drugstore and you're just buying any antibiotics. First of all, you don't even know drugs have what they call half-lives. You don't even know the half-life of that medication you're taking. You don't know what the side effect is. So and that's how an abuse of antibiotics can cause infection, because it will disturb the normal flora of the vagina, and then the person is prone to infection. Or maybe you just go and ease yourself where someone that has a yeast infection urinated and the urine just splashes in. Remember that you're already a little bit immunocompromised because of the antibiotics that you're already taking. So there is nothing basically fighting back against that infection that you just caught. Barrister, did that make sense? Yes, that's you that asked the question. Sir, did that make sense? Did you understand the
He,
answer?
I'm sure he understands you. Yeah, I'm sure you make a whole lot of sense. Yeah. So people out there, just take it, especially our ladies. When you take antibiotics, you just go to the pharmacy, you buy amoxicillin. Well, I've seen somebody taking antibiotics for close to 1 month, more than 1 month. She just kept. Now somebody goes to the hospital. Doctor say, okay, take amoxicillin for a period of 2 weeks, or take Cipro for a period of 1 week. When the person finishes that antibiotic, instead of the person to report to the doctor, say, okay, I'm done with this drug, the person goes back to the pharmacy, a lady goes back to the pharmacy to buy the antibiotics again. So continues for another space of 2 weeks. And the thing is, while you keep taking these antibiotics, you keep killing all the normal, there are bacteria in the vagina, normal bacteria in the vagina, even in the penis, there are normal bacteria. But when you keep taking these antibiotics go there and kill all those defensive normal bacteria in the vagina. Now, when that happens, there's what we call opportunistic infections. They'll now say, okay, all the defenses in this area now have died. Well, let's go and multiply. So you see yourself having plenty vaginal, whitish, milkish discharge that is abnormal. That is because you've used antibiotics to kill all the normal defensive bacteria in the vagina. You've killed all of them, and you've given rise or allowed opportunistic infections. They take advantage of opportunity. That's how you understand it, to destroy the uh, the environment of the vagina. All right, thank you, Dr. DG. Someone is saying something again. Another
Okay.
question. Very good presentation. Yeah, it's a very, very wonderful presentation, actually. Um, Very good presentation, though I signed in late. Please, can you display an image of yeast infection and how it can be treated? Hmm.
Okay.
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 An image of yeast infection and how it can be treated. So, over to you.
Okay. So why doc help to please get the image? So let me paint an image to the person that asked this question. So imagine cheese. You know cheese or lumpy egusi. That is the kind of discharge that the person will be having. I'm not saying I have seen it, okay? I've seen it, so that's I can describe it that way. So yeah, like cheese. That's what it looks like. That's the discharge that the lady will be having. Itching, you'll be having a lot of itching in the vagina area. Okay. So while he's still looking for the image, I hope you can picture it while he brings it up. Okay. And how it can be treated. Still um antibiotic that I will not mention. You need to see the doctor for the doctor to prescribe it and tell you how many milligram you're supposed to take and for how many days it's supposed to be, or maybe 14 days or just 7 days. Okay, so that's my reasons for not mentioning any medication. All right, so I hope you can see the image now. Sister Judith, I hope you can see it.
All right. So I guess we are done with that question, right?
Okay.
Okay. Another question coming in.
Any more questions? Oh my god, running
Think,
out of
don't
time.
worry. I guess it should be the last question
Okay.
since they are not dropping more questions. Sister Judith says she gets it. She understands now.
All right.
Yeah. So, can wearing one boxer for more than 1 week cause pile or growth in the on the anus?
Okay. No, sir, it cannot. Pile is hemorrhoid. Dr. Promise, I'm right, wrong, right? I'm using the right word. I don't know.
You are very, very right.
Pile is what is called hemorrhoid. Right? That's what it's called again, Dr. Promise.
Yeah, that's what's called
So, sir, no,
hemorrhoids.
it cannot. Wearing one boxers for 1 week cannot cause pile or growths on the anus. No, sir, it cannot cause it. Pile is what is called hemorrhoid. Huh? Yeah. Or it's kind of a, how do I explain it? No, not hemorrhoid.
So
I'm
let
trying
me
to
come
get a
in there.
better word to Yeah, please. I need a layman's term. Please explain in layman's language. That's what I've been
Hemorrhoids
trying to find out.
or
Find.
pile. Thank you. Yeah, hemorrhoids or pile is like a protrusion, something
Mhm.
coming out of the anus. Okay, something shooting out. Okay, it could be as you could see it as a form of flesh. Okay, just sticking out of the anus. Yeah, just sticking out of the anus. If complicated, that is, if it could be dangerous when it starts bleeding. Yeah, and it mostly happens in people who we can let's start this way. In women, it can happen in women if they have a weak pelvic floor.
Yeah.
Sorry that I'm using a big word, but for women who have given birth a lot, maybe, or women who engage in
Anal.
strong men or women who engage in strong abdominal exercises,
Mm-hmm.
okay, can force the the anus to pull out. Yeah, it just shoots out there. So that's called hemorrhoid. Those who go to the toilet and when they are in the toilet, they are there straining, doing
Right.
yeah, the anus can shoot out. So these are things that cause hemorrhoid. Straining while defecating, while in the toilet. Hard stool as a result of the stool being hard. So you see the person trying to force himself or herself to stool. So those are the causes of hemorrhoid, and to prevent it or to help in curbing, avoiding such things happening or stopping such things from happening, you need to take foods that are more in fibers, like
Yeah.
oranges, like watermelon, like
Yeah.
cucumber. They will help to soften your stool and help you, you know, with time it's going to reduce the pie, okay, the size of the pie. But it's also important for any person who is passing through this to see a medical doctor for them to examine it, to grade it, and know what exact solution should be given to
Okay.
that stage of pie.
Yeah.
Okay,
Just to add to what you said, Doc. Yeah.
good.
Why it's important to also see a doctor is because it could have what is called internal hemorrhoid. Okay, so it's coming from inside. Why there are some that are out just on the outer part that maybe later I could just go back inside. If it's coming from inside, I think you need to see a doctor so that it could be surgically fixed. Okay, because that no matter, I think that's the one that is called internal hemorrhoid. It's not something that can just go. It needs to be fixed by a surgeon. Okay, they need to either cut it out and suture the remaining part, okay, back. So it's good to visit a doctor for them to like Dr. Promise said, to ascertain or grade it. Grading it is to make sure an internal something
Mm.
that can be fixed. So that's why it's important. And if you're having such, please don't eat red meat. You can eat fish. Abstain from red meat, okay? Yeah.
Okay. um is it healthy to sleep with pants on? I want to assume that it's a sister that's asking this question. Is it healthy to sleep with pants on? Is it healthy?
Okay, so he says it healthy. Please, in the night, just be as free as the bed. Just put on your nightgown. You don't need to, you need the blood flow to go circulate your body, except maybe you visited somewhere that, okay, even if you must put on pants, let it not be very tight. All
Hmm.
right? Let it be loosed, loosen.
All
But
right.
if you have your
So,
own apartment, just it's better not to sleep with any at all.
all right. Thank you so much, Dr. DG.
You're
I can
welcome.
tell you that a whole lot of persons are impressed.
Yes.
They are happy. Yeah, they are glad that they partook in this presentation, and they are happy with the way you presented it. So we
Thank
want
you
to
very
thank you
much.
so much for taking time out of your busy schedule to see that you educate the young adults forum of the Watchman. Someone says, Doctor, thank you for this program. So you see, a whole lot of people are actually I'm, I'm going to share with you even privately. Someone says it's very informative. Okay, very informative.
Okay.
Another person says so much information. So you see that this is very, very wonderful and interesting. And I want to let you know that we are going to host you again because this is just the beginning. Okay, yeah.
I hope I will pray I
If you
have the
have
time.
our listeners, if you have a good word, something nice you want to let Dr. DG know, please can you say it in the comment section? I'm sure she's going to see it. If you are happy with her presentation, if you're glad with how she presented, please just type it in the comment section and she will see it. So thank you so much, Dr. DG, for coming on
Thank
this
you very much.
presentation. We are glad to have you on this topic, and we hope that our listeners and those who have participated with us here enjoy the show. So we're going to see you again. For our listeners, I want you to remember that we have what's it called? A praise night next week Friday by 11 p.m. So please don't miss it. Don't miss it. We have a praise night by 11 p.m. Please don't miss it. Don't miss it for anything. All right. So thank you very much. And I say good night to everybody and see you next week Friday. Bye
Thank you,
bye.
everyone. Yeah, bye. Thanks for listening. I really appreciate it. It's my pleasure. Okay. I really, really appreciate that everyone listened and got some useful information that we will put to practice. Please, don't just go listen, I no go do anything. Just do something about it, okay? And I really, really appreciate the love and the appreciation. I really, really appreciate it. Thank you, everyone, and God bless. Much love from me to you, and God bless you.